Hello everyone, it is another edition of COVID-19 updates where we bring you the latest information on the coronavirus pandemic and its rippling effect on the world. I am EMMANUEL and this is VNTV. Now let's start from the local front here in Ghana, where as of 9th June, 6 o'clock GMT, the country has a total of 9,910 cases with 3,645 recoveries and 48 deaths. The Greater Accra region still remains the hotspot for the virus with 6,436 cases, followed by the Ashanti region with 1,734 cases. Now, we're still not in normal times, so please adhere to the government precautionary measures and make sure that you are safe. That is what the Ministry of Information and the Ministry of Health continue to say to the Ghanaian public. Still in Ghana, mental health experts in the Ashanti region say they are seeing increasing anxiety disorders and depression, especially in young adults linked to the COVID-19 fear, as Ghana is still battling the insurgency of the virus. Now, they reveal that many young patients have conditions stemming from fear of contracting the virus and also losing their livelihood. Now, moving away from Ghana, let's look at another country in the West African sub-region, that is Nigeria, where as of 9th June, 6 o'clock GMT, the country has a total of 12,801 cases with 4,040 recoveries and 361 deaths. The Lagos state also remains a hotspot for the virus in Nigeria with a total of 5,767 cases, followed by Kano with 999 cases. Now, still in Nigeria, Abia State Governor Okezie Igbazu, I hope I got the name right, is the latest leader of state governments to be affected by the COVID-19. Now, Abia Governor of Information confirmed this week that the governor had tested positive for COVID-19. Now, John Ukiye added that the governor had gone into self-isolation and subsequently directed his deputy to act as governor whilst he undergoes treatment and hopefully resumes to duty very soon. Now, still staying in Nigeria, their health minister, Usagi Inahere, has said up to 60% of nearly 1,000 unexplained deaths in the northern state of Kano were probably due to COVID-19. Now, an investigative team reached the conclusion after looking into a spike in deaths across Kano State in April and early May, mostly among elderly people with pre-existing health conditions. Now, some died in hospitals, whilst others died in their homes. Moving away from West Africa, let's look at what's happening in other parts of the continent and into Tanzania, where their president, John Magufuli, declares Tanzania free of COVID-19. In a statement, he stated that the corona disease has been eliminated thanks to God. Now, he told worshippers in the church in the capital, that is Buduma. However, the World Health Organization has expressed concern over the government's strategy on COVID-19. The government has stopped publishing data on the number of coronavirus cases in the country. On 29th April, with the last day official date was released, there were 509 cases with 21 deaths in Tanzania. But however, the president has stated that last week there were only 4 patients who were currently in admission in hospitals receiving treatment of the virus. Now, moving away from Tanzania to the southern part of Africa, the mayor of South Africa's commercial hub, that is Johannesburg, has gone into self-isolation after a member of his staff tested positive for the coronavirus. Now, a statement from Geoffrey Makuba's office said he was taking the precautionary measure until the result of his tests are known. He had previously returned a negative test. All staff of his office have also undergone tests, awaiting their results after the latest case in their office. Now, moving away from the African continent, let's look at what is happening in Asia and into the capital of India, that is Delhi, because they have added around 1,000 new infections on Monday, taking the total in the Indian capital to nearly 30,000. Now, also, its highest daily spike, more than 1,500, was recorded, earlier this month. But its upward trajectory that experts worry as the city continues to ease out lockdown this week. Delhi has also reported more than 800 deaths. Now, a 5-member expert committee of top doctors told reporters Delhi could be looking at 100,000 COVID-19 cases by the end of June. The western city of Mumbai, India's financial capital, is still the worst hit in the country with more than 50,000 cases and still rising. Now, moving away from the Asian continent, let's look at what is happening in Europe and into the United Kingdom, because plan for all primary school years in England to go back to school before the end of term is to be dropped by the government. Now, in a statement, the Children's Commissioner for England, Annie Longfield, told BBC Breakfast the news would be a huge disappointment to children who had expected to be going back to school and now may not be able to go back. She also said children would still need to learn during this period and called for mitigation to compensate for them not being in school, including online learning and summer camp. Still, in the UK, more than half of pregnant women recently admitted to UK hospitals with coronavirus were from a Black, Asian or minority ethnic background, a new study has found. The peer-reviewed research published in the British Medical Journal looked at data for pregnant women admitted to 194 obstetric units in the UK with a positive COVID-19 infection between March 1st and April 14th. It found out that the 427 pregnant women in hospital during that period, 233, that is 56%, were from BAME backgrounds, of which 103 were Asian and 90 were Black. Moving away from Europe, let's end this bulletin with what is happening in South America, where Brazil's President Jair Bolsonaro's government stopped disclosing comprehensive data on coronavirus cases and deaths as cases continue to soar. Now, Brazil's health ministry took down the website where it had been reporting corona statistics on Friday. And then when it came back online on Saturday, the site omitted the historical data, leaving out how many people had already been affected or killed because of the virus. Now, this is where we draw the curtains on today's COVID-19 update. But let me remind you that we're still not in normal time, so please make sure to practice these basic preventive measures like washing your hands with soap and running water, making sure to use alcohol-based sanitizer regularly, covering your nose when you have to leave outside, and when you have nothing doing anywhere, please stay home. I am EMMANUEL, and this has been VNTV.